the way in which food allergies can have an effect and can manifest in the mouth. Gluten being a big one. There was a terrific systematic review that was published out of Italy just last year in 2023. And it really expanded on this concept of how gluten sensitivity has atypical manifestations in the mouth. So we know that it can contribute to an increased decay rate. It can contribute to xerostomia, canker sores. If you're a patient who gets canker sores frequently, gluten is now being, we're beginning to make the correlation that gluten is definitely plays a role in recurrent aphthous ulcers. The benign, for years, we were told as dentists that, when people have spots on their tongue, patches where they no longer have any papilla, called geographic tongue, we were told for years it was benign and, just an incidental finding. Well, it's now definitely tied to gluten sensitivity and celiac disease. There's an inflammatory periodontal disease that can happen, bacteria free, but due to the fact that it can stimulate loss of bone in the mouth. So there's lots of clues that we can get from a comprehensive oral exam and determining, what's actually going on in that individual patient.
Yeah. And it's, gluten, gluten, especially in America, and just realizing that it's for people that it's not all about your belly. And I think that's what is so important. And thank you for emphasizing that, and making sure that people, when you go to your dentist and you have inflammation, think about what you're eating.